guys, if you can hear me okay. So, welcome to my first live stream. I'm glad to have everybody here. And I'm really excited for everybody to start learning how to manage their care. So the reason why I'm here today is because I wanted to teach everybody how to manage their own health care. My name is Jennifer, by the way. I've got a master's degree in healthcare administration. I've been in the medical and pharmaceutical industry, medical device and pharmaceutical industry for a number of years prior to making Patient Better. But Patient Better is a navigational tool to help people manage their health care more efficiently and effectively in today's medical landscape. What does that mean to you guys? You guys will be able to identify when it is appropriate to go to the emergency room. It saves you from rehospitalizations and stuff like that. And then, of course, not as many office visits. And then the visits that you do go to is going to be very fruitful, and you are going to have a lot of information, and you're going to get your money's worth and your time. So without further ado, I said that we were going to have one purpose today, which is going to fill out a template called the Patient Better Tracker Tool. And what it is a list that you make. It's a template for all the doctors that you've had, both currently and that you've seen in the past. And the reason why you want to do this is because the physicians that you see, come and go. And your conditions, how you manage them, they get cured, they go in remission. Providers, retire, they change jobs, stuff like that. So what you want to do is you want to have a better control in this. With that being said, okay, just checking to see if anybody's chatting with me yet. With that being said, it's important to have all of your physicians in the same place at all times, because you never know what's going to happen. Because if you ever do go into the emergency room or something like that, there's a precursor, something comes, a condition comes back up, it hits you like a wall. And so having all those physicians, especially if you're in the emergency room or if a disaster hits, FEMA's taking care of you, they need somebody to organize their medical records, then this would be the perfect thing to do. Okay, so with that being said, let's just go one by one, and we'll just do this. First physician, and it's really nothing to it. A lot of people, I've had a lot of my patients, just going, oh, I do not know how to manage the medical. I do not know how to manage my physicians. I don't know where they came from. I don't know how to obtain the records. I have no idea what they're doing. And then, you know what? If I call a physician's office, they're busy. It takes 30 days for them to get a medical record back. By then, they've forgotten about me. I wait 45 days at the allotted time. Boom, they still don't come in. So what I wanted to do when I created this template was to save everybody from having to go back and forth and find the pertinent information quickly. So with that being said, there's only 3 to this sheet, but I've got a link down below that you guys can, print out as many as you want for free. Just as long as you guys keep up with with Patient Better, you guys will have all kinds of templates to fill out and save you guys a lot of trouble, a lot of heartache, and give yourself a peace of mind to be able to manage anything that comes under your watch, or under your loved one's watch and stuff like that. So with that being said, this is going to be a pretty helpful template to you guys. Like I said, there's only 3 physicians here per person, or per template, but go ahead and fill out as many as you need to. Probably over the course of life's one span, you might have a small book. So with that being said, so the first thing you're going to want to do is go to fill out the health professional's name. Pretty cut and dry. It doesn't have to be the exact name. It doesn't have to be the professional name, just as long as you have the name and their title of what they do, whether they're a nurse, a physician assistant, the physician, the provider, a surgeon, whatever the case, what their specialty is. So even if they do have multiple specialties, or if they're just general, what you want to do is just, if they do have something, because for insurance reasons, let's say you had arthritis, or you had cancer, or you have some kind of neurological disorder or something like that, whatever the doctor is, do the condition that he saw you on. So he's a specialist here, specialist on what what you saw the physician for. If they have a hospital affiliation, so here in Houston, if a physician has if a physician has uh, like an affiliation with another clinic, like for example, the VA down here, the Michael Veterans Affairs Hospital down here, oftentimes they will have other physicians working in other places. So if you were going to the VA, you might see them as well at Baylor, just depending on if you have a family member or something like that, you might see them. So whatever hospital affiliation they have to that person. So whether if you were going to the VA and like maybe your daughter that you're taking care of, or somebody is going to Baylor for whatever specialty, you want to put that affiliation with that physician. And of course, seen from dates. So the first time you saw the physician to the last, where they discharged you or whatever the case is, whether it was in the hospital or chronic illness. And then of course, the next is the last seen date. Put the address, the city, the state, the zip code, and the suite number, of course, the country if you have it. So if you are traveling or whatever the case is, make sure that you have their information. So if you're going to Bahamas, Jamaica, Mexico, whatever the case is, you want to put the country down as well as the physician. So this is, and the reason why this physician list might work a little bit better for you is because it's not system related. It is not condition related. So that means that a therapy, like a certain drug or whatever that's only seen these kinds of physicians, this is going to be yours. So if you had, if you were living in another country, or if you traveled to another country and you saw a physician and you want to keep up with them, if you travel to that country often, stuff like that, you want to make sure that you always have the same. And this is for your list, your eyes, and your ability to communicate. So it has nothing to do with anybody else. You just worry about yourself when it comes to this template, and you take care of yourself independently, and it will last with you for the rest of your life. Now, you may want to consider, if you have the capabilities right now. If not, you work Patient Better program, you should be able to do this. We will help you if you need to get onto the doctor's website. Most physicians have them these days. Some of them don't, but if they do have them and they do have a portal for you, you want to make sure that you use that as much as possible. So with that being said, make sure that you put down the website. And then, of course, the primary treating condition that the doctor saw you for, their email, if they have one. And we can talk about that later in, we can talk about that later in Patient Better, and we can talk about this next week or whatever. I would love to hear y'all's comments on that. But what we can do is we can talk about how we can utilize telemedicine, and really not just for colds and sniffles, but I mean really complex conditions, the ones where you're not mobile, the ones that you're homebound, stuff like that. You want to make sure that you use telemedicine. It is out there. The only thing we have to do as patients and caregivers is learn how to really make it work for us. And I've got the tools in Patient Better to do that. And then, of course, the portal information. So you want to have your username, you want to have a password, and then you also want to write that down right here on each one. If you feel uncomfortable putting the passwords, of course, you can always use a doc, whether it's Word doc or Google Doc or whatever the case is, and then you want to put the passwords there. Otherwise, this is, pretty secure information, because the last thing you're going to want to do is, especially if you do have a home care team, you have a daughter taking care of you or whatever the case is, then inside your health manager, your Patient Better health manager, put this sheet in the front pocket and put all of them there. And now remember, all you have to do this is once in your life, and you're pretty much done, and you're just adding to the list as it goes down. And with the seen on date and stuff like that, you would be able to, this is a chronological, so the most current doctor will be the last in this sheet. And that's pretty much it. So with my first live stream for Patient Better. And so you have your free template. And then, of course, I've got an article for you guys to read, which I will also put in the description box below. And then all you have to do is put that template right here, filled out, right in the front pocket of your health manager. And I wanted to say, you guys, thank you so much for listening to what I had to say. And I look forward to seeing you next week. Take care and God bless you guys. Have a wonderful day.